Hi everybody, how are you? And welcome to day 82 of the 90-day share. My name is Dr. Brooklyn Storme and I'm the director and the principal psychologist here at Cerebellum Consulting in Frankston. And yes, it's Saturday, here today with a fully booked diary. Can't wait to see all the little munchkins that are coming in for their appointments and some bigger munchkins too. And what I wanted to talk to you about today was some of the top three mistakes people make in counselling. And I thought we'd just go over these, and I'll also give you some ideas around how you can fix them for yourself and get the absolute best chance of success out of them. Hey Karen, how are you going? So I guess the first mistake that people make in counselling is having unrealistic expectations. And what I mean when I say that is thinking that counselling is going to solve your problem really quickly. It's highly unlikely that that's going to happen. Why? Well, for the simple fact that it takes people a long time to work up the courage and be brave enough to actually come for a psychology appointment in the first place, yeah? A lot of the time the presenting problem has been developing for a period of months, maybe even longer. So we have to understand that turning up for one or two psychology appointments isn't going to be enough to resolve the concerns and all the underlying issues that are associated with that problem, yeah? You need to come consistently and for an ongoing period of time if you're going to get well, okay? That's the first thing. So being aware of what you can expect from counselling. The second thing is failure to implement, okay? So when you're coming along to see your psychologist, he or she is going to be giving you lots of things. They're going to listen really deeply and try and understand what it is to be you, and what it is to experience all of the things that you're experiencing as well. Then they're going to try and, I guess, point you in the right direction so that you can steer your own ship, okay? They're going to give you information. They're going to educate you about whatever it is you need, like maybe it's an education about anxiety or depression. Maybe it's information about tools and techniques that you can use. They're going to provide you with strategies usually, okay? So again, if we're talking with somebody who might be battling with anxiety, we might give them a breathing technique. So we're going to give you, or your psychologist is going to give you a lot of stuff. But it's up to you to implement it. If you don't practice these tools and techniques and strategies in between her sessions or his sessions, you're not going to get well, okay? When you come along, you might practice some tools or techniques in the session, but it's really important that in between all of the sessions, you're practicing, and that's because with practice, like anything, it's going to help you become more proficient in using those tools. Once you develop proficiency, you'll be able to then implement those tools to help you cope with the real struggles that you're experiencing in your life. And then over time, hopefully what you'll see is some improvement. The last thing, and it's not really a mistake, I guess it's just a misunderstanding about what a mental health care plan does. So here at the practice, we get calls every day of people ringing up, wanting to book appointments, and they say, oh, I'm just going to use my free ones. And it's really worrying that so many people have this misunderstanding that a mental health care plan means you get, 10 free sessions. That's not what a plan is. I like to explain it like this. A mental health care plan is like a discount voucher. It's a voucher or a coupon that allows you to redeem some money back towards the cost of your session with your psychologist, okay? So on the day, you're going to pay the psychologist the full amount, and then you're going to use your plan to redeem part of the cost of that session back, okay? So thinking about a mental health care plan, hey Tess, similarly to a redemption voucher or a discount code or something like that is probably the easier way to think about it. So they're the three common mistakes that people tend to make in counselling. So what can you do? Okay, well, we're just going to do the opposite. So the first thing that we're going to do is be clear about our expectations in terms of how quickly you're going to get well. Counselling is not a quick fix, guys, okay? Understanding that you need to attend counselling consistently so that we can work on the problems and address whatever might be going on for you. The second thing is do implement the tools, the techniques and the strategies that your psychologist gives you, they're giving them to you because they've been evidence-based, they've been demonstrated to be clinically effective, okay? So you're here because you want to get well. We're saying try this because we know for a lot of people it's going to work and help you improve. And lastly, being clear about your mental health care plan. And I just think we are so lucky because this mental health care plan allows you to redeem back part of the cost of your counselling sessions 10 times in a calendar year. That's just so cool. I really do think we live in a lucky country sometimes. I mean, for our psychologists here, that means all our patients can redeem back $850 every year towards their counselling. Isn't that amazing? So keep in mind just how lucky we are to have all of these services here. So that they're the 3 mistakes, 3 strategies on how to change your thinking around these mistakes. And I hope that this has all made sense and that you get some value out of this. Now, I did drop a little post up on Facebook this morning before I left for work today, just asking you guys if there's anything you want some information on, please let me know. I've got another 7 or 8 vlogs to do, so I'm happy to answer any questions that you might have. I'm doing them for you, so it's absolutely my pleasure. And if I can't find information, I will certainly ask a colleague and maybe we can interview them on here or something like that. There's plenty of things that we can do. Thank you so much for joining me today. I hope you all have a really lovely weekend. If you're in Frankston, feel free to stop by. We can have a coffee. Nice to see you. I'll talk to you later. Bye guys.